or has difficulties with it, please contact Polly James, who's administrating the programme, and we'll deal with your enquiries about that. So this afternoon we're here to share our experience and of delivering a project in the north of England for support roles in mental health, and that particular support role is the assistant practitioner. One of the things that I think it's really important to explain is that this role of assistant practitioner isn't a new role. It's an existing role, but that is new to a lot of mental health settings. So that's really important to kind of set the scene, because what we will be describing is a role that already has a competency framework and is matched into an apprenticeship standard. And the work that we've been doing in the Northwest is to look at how we can facilitate and encourage adoption and spread of that role, which has been very successful in physical healthcare in previous years. How we can encourage mental health services across a range of settings to take up the role in order to improve and develop care pathways. So I'm really pleased to be able to introduce our three speakers this afternoon. We have Kay Helliwell, who is our Assistant Practitioners for Mental Health Project Team Manager. Kay's going to talk to you about the project, the rationale for it, and the work that we've done. We've then have Lindsay Robinson, and Lindsay is one of our trailblazer education sites from the University of Central Lancashire, and Lindsay's going to explain about the training programme and also how the Apprenticeship Levy supports the funding of the role. And then we have Laura Smith from the British Psychological Society, and Laura's going to help us stand back and talk. She's going to talk to us about the work that's being done within the BPS, looking at how the psychological professions supply pipeline might be enhanced by the development of support roles within the psychological professions. So a really interesting piece of work about how support roles more generally across the psychological professions are part of what the future work and thinking around those for the BPS is. And then we have an opportunity for questions and answers. I think we haven't factored it into the timing of the programme, but we will have time for a comfort break after Laura. So without further ado, I'll hand over to Kay to start the afternoon. Over to you, Kay.
Thanks, Claire. Good afternoon, everybody. I'm going to just share my presentation with you.
Okay, just whilst you're sharing your presentation, sorry, I forgot to ask, if people have got questions, can you pop them into the chat bar as we're going through? What we'll do is that we'll pick up all the questions in the question and answer session after the three presentations have been done. Thanks, Kay.
Thanks, Claire. Okay. See whether the technology will work. Hopefully everybody can see that. Just trying to put it into slide mode, but doesn't seem to want to do it. So, can everybody see that?
That's fine, Kay, we can see that, thanks.
Perfect. I'll leave it as it is then and go forth. So yes, good afternoon, everybody. My name's Kay Helliwell, for those of you that don't know me. I'm the project team manager for assistant practitioners across the north of England. And I was invited here today to talk to you about what we're doing in the Northwest. So what I thought I'd do is give you a little bit of background to the project, give you sort of an overview of the role of an assistant practitioner, what the transformational contribution that an assistant practitioner can make, the sorts of things that we've done so far in terms of the project across the north, and what we've learned, and then obviously questions at a slightly later date. So just to give you a little bit of background, this slide here just shows the number of APs that are basically in physical healthcare. what it nicely shows is that there is a disparity in terms of the numbers that are actually working within a mental health care setting. And it was from this that a project in the Northwest was initiated, a pilot to look at, sorry, let me step back a bit, sorry. So what happened was these figures were looked at, as I say, it shows that there's a discrepancy of the numbers actually working within mental health settings. And what they did in the Northwest was they went out to the system and they said, is there a reason you're not recruiting to this role? Is it just that you don't know about it? Is it a role that isn't needed? And what came back overwhelmingly is that, yes, it is need, and it looks like a really good role. And from that, there was then a pilot that was run in the Northwest, and subsequently that led to the project that I now lead, which is across the whole of the North, with the intention to increase the number of assistant practitioners working within mental health settings. So that's how we started here. So if I take you to this next slide, the role of the assistant practitioner essentially is a trained senior clinical care support worker who competently delivers health and social care to and for the people. And I think the key word there is competently. So as we've already discussed this morning, there's already a framework in place, and that framework is a required level of knowledge and skill above that of a traditional healthcare assistant or support worker. It's a band 4 on the NHS careers framework, and it's designed to work across patient pathways and offer additional flexibility in the delivery of new care models. And it is also extremely good at working across professional boundaries. There is a link there in this slide to a report, so you'll be able to have a bit more of a look at that beyond my discussion today. So one of the questions that I frequently get asked by people are, why do I need an AP when I could have a TNA? So what we decided to do was pull this slide together to really hone in what is the difference between these two roles, because they are two very distinct different roles. So as you can see there, the nursing associate is designed to bridge the gap between healthcare assistants and registered nurses. That's what the nurse associate is there. The assistant practitioner, however, is there to bridge the gap between healthcare assistants, support workers and registered professions. So they are two very distinct different roles. And as a result, we pulled this slide together to try and give people a little bit more of an understanding of where these roles sit. And another one we get frequently asked is, why do I want an AP when I could have a PWP apprenticeship? So if you look in the centre of this slide where it's got the nursing associate, you can see there's a direct arrow up to nursing. And so it's got a very broad application. It's there purely designed to feed the nursing workforce. The other areas that you can see that are highlighted in yellow / orange, we know it can go through to those areas as well, but predominantly it's there to go into the nursing workforce. Equally, the PWP apprenticeship, that again has a narrow application because it's there predominantly to serve the psychological professions workforce. Again, we can see it goes into other areas sometimes, but the route is up to psychological professions. Whereas if you go to the left-hand side of the screen and look at the assistant practitioner, you'll see that there are green in a multitude of different professions. So it's a much wider application that this role moves into. And I think that hopefully explains the differences between these three roles. And equally, if we just have a look at the academic standing of the roles as well, the assistant practitioner is a level 5, as is the nursing associate, but the PWP apprenticeship is a level 6. So again, there is distinct differences there within those roles. This slide here is just designed to kind of give you an awareness about how the role of an assistant practitioner can lengthen the career ladder and help with widening participation, and it uses IAPT as a case example. I think we touched earlier on we might have people that are sat within administrative functions that we know would make really good APs. We might have healthcare assistants that are already out in service. And equally, we might have people from outside of our service that we want to bring in with lived experience and widen that skills mix and that participation of our workforce. So what this shows is that the access point is there at a different point to what's currently available. So that really does help us lengthen that career ladder for somebody. So if they come in at an AP, they'll study with you for 2 years. They would do obviously some CPD and then maybe move on to other routes. So potentially what you're doing there, if you think about services growing their own staff, growing their own workforces, retaining workforces, by having a clear, defined career pathway in place, it really starts to lengthen what is available. So I think we mentioned this earlier on this morning. So as a result of the pilot that took place in the Northwest, there were 4 key responsibility areas that were seen as that could be done by the role of an assistant practitioner. And these were around supporting multidisciplinary teams with organisation, implementation and coordination of tasks. And so we include in social prescribing and care navigation, around patient involvement and engagement. So that could be around collating patient feedback, following up patient experience questionnaires, and inputting maybe into service quality assurance processes. It was also around community engagement, so building the connections with community groups and resources and helping to bring those areas that are hard to reach or marginalised parts of the community, making those links with that part of the community. And support around coordination of psychoeducational groups, supporting the organisation and running of the groups, following up on DNAs and gathering service user feedback. So they were the kind of the 4 main areas that were seen as an AP's role. So if we look at the transformational contribution that it could make, and there are a number of areas that this role can really make a contribution to. So if we think about patient care, it's really about supporting transformation of mental health care pathways by increasing the skills mix of the workforce. If we look at widening participation, it really does enable careers of individuals employed on Agenda for Change bands 2 to 4. It helps us to diversify the workforce so we can recruit individuals that for whatever reason maybe haven't got the what we regard as standard qualifications, but we know would make a really good AP. I think I've already mentioned people with lived experience. It offers them the opportunity to come into a career pathway into mental health. And again, if we think about workforce growth and retention, as we know that's an issue in some areas, it opens the door at a different point and it lengthens that career ladder into mental health and really allows people to grow their own workforce. We know that this is a role in its own right and that a large proportion of people that become assistant practitioners quite often stay as an assistant practitioner. So what that means is if we think about our workforce planning and we look at recruiting year on year into an assistant practitioner role, we really then start to look at increasing capacity and enabling people to have that career pathway. And then, of course, it's sustainable work-based earning and learning. So if we look at maybe healthcare assistants that might make really good APs, the idea that they would have to leave that role to go and educate themselves further is going to be something that's quite a hard task. Through an apprenticeship, you're working and earning and learning all at the same time. Services get the benefit of having extra capacity in service, and students get the benefit of learning whilst they're doing it. So I'm just give you a little bit of overview about the training. Lindsay, who's following my presentation, is going to talk to you in more detail, but in essence, it's a Band 4 on the NHS Careers Framework. It's a higher apprenticeship model where trainees spend a day at university to take what is a 2-year foundation degree programme. And then this is kind of really key. Within this training, there are core and specialist modules that are tailored to the intended area of practice. So all this discussion that took place this morning about specialising to renal, into medical specialisms, this is where that will come through in these work-based modules where it works in a party arrangement between the university, the employer and the student who agree a project of work that not only meets the training but also meets the needs of service as well. Care certificate is built into it. It is supervised practice throughout training to completion of the programme by a trained mentor, and the entry route for an AP is Band 2/3 in the first year, Band 3 in the second year, and then on successful completion progressing to a Band 4. So if I kind of give you now a little bit of information about what we've done in the north, because as I say, it's a north project that we're running here. So what's happened there is a workforce development offer has been progressed and offered by HEE in the Northwest. We've worked with a number of HEIs and FEs across the whole of the north who are interested in working with us to adapt the existing framework to include mental health, but not in the sense of having an add-on of mental health. What we've done is work with them to embed mental health throughout both the 2 years in each of the training areas. We've also held some, we've engaged with providers and scope demand, and I'm really pleased to say that over in the north there is good demand for this role. What we also did was we ran some stakeholder events with service providers, looking at what the role can offer, how they might implement that role, and the sorts of challenges that might be in place to providers in taking this role up. Currently, we've got 2 cohorts that are being delivered, and we have a 3rd cohort planned to start in spring next year. And we have also developed a steering group. Now, the members of the steering group are comprised of the service providers themselves, the HEIs, we've got representation from the BPS, from HEE, from the local STP teams within HEE. And so the idea is that we all come together and we collaboratively work on what's needed to to progress the role, to ensure that we're all training to the same standards, and to work out any of those issues that, as we all know, sometimes come up when you start a project of this size. So we're also going to be looking at the development of a peer support network, and we're pulling together a web page and a mentor toolkit that is also in development, so that beyond this project there is something there for people to refer to, and whether they're somebody who is interested in being an AP, or whether they are indeed a service provider who is interested in taking one on. So I kind of put this slide in really just to give you a sense of what the offer was and is, in fact, that's come from Health Education England in the Northwest. And it's a training support package, and it's for NHS and NHS commissioned providers of mental health and IAP services. And it's also about integrating practical support to help develop the capacity of both NHS and PIVO mental health services, and around monitoring and quality assurance in terms of the uptake and application of the role across those mental health settings. So there is, in terms of the university fees, they are all drawn from the Apprenticeship Levy. And I'm not sure, I think I may have included a little bit about the levy. In fact, no, I didn't. I decided to leave that to you, Lindsay. But basically, whether you're a levy payer or not, you still have access to the apprenticeship levy for training funds. So from a sustainability perspective, that's where the money for training is going to be coming from going forward. And then in addition to that, what HE have done is offer a training grant package pitched at a midpoint band 3 for 2 days a week. So that's the offer that's currently out there at the moment from us. And then what I thought I'd do is just give you a bit of a graph view in terms of the 2 cohorts that we've currently got in place. So what this shows is the kinds of settings we've currently got APs in. Gives you a split between NHS and third sector and PIVOs, and also a bit of a split in terms of STP area. But if I go to the service areas, we've got a really good range of settings that we have assistant practitioners in, ranging from end-of-life care, primary care, GP services, children and young people, IAP services, and community wellbeing. So we've got a really broad range of where these practitioners are sitting. So in terms of what we've learned and the sorts of things that we've come up against whilst we've been delivering this project are really around, in terms of helping people really understand what the role is and what the wider support networks, workforce landscape, where it sits within that. So it's really about understanding the role, which goes back to those earlier slides, the differences between maybe a TNA and an AP. Formulating a rationale with examples, so linking that key workforce and delivery issues to widening the supply pipeline, looking at widening participation, looking at how services want to develop talent, grow their own, and new ways of working in terms of innovation in care pathways. One of the things we know is we need to get the right people in the room to explore some of those challenges that may exist. And when we think about relevance, it's about really reviewing the existing education programme and seeing how it might be tailored, which is exactly what we've been discussing this morning. And sustainability really does have to be at the centre of this from the beginning. And I think, again, we touched on this morning, it's really important for services to understand the role, to have a good, clear pathway about what the role will do, where it may go on from that. And then that avoids role creep that we were talking about this morning. I think there is an element of persistence, system change doesn't necessarily come easily. I think, it's something we have to revisit, and, if we have a clear rationale for what we want with examples and we understand how this role works, then that makes life a lot easier in terms of taking that to service managers. And then some of the challenges we've met are around maths and English entry criteria. So currently, if somebody doesn't have that now today, they can still start the course so long as they study it alongside the course itself. So as long as they've completed their maths and English, they can still enter this course. And that really is something that, in terms of apprenticeships and in widening participation, I think that's something that we really need to make sure that we allow to happen. As I've said already, there's lots of people out there with non-standard qualifications that would make really good APs. And so this is one way of ensuring that we don't lose those people down to when there is support there to enable them to come on board. And also, I think we might pick this up maybe in the discussion panel, but just around endpoint assessments. And I think, you know, it's really important that organisations understand these endpoint assessments must be done. They currently sit outside the programme. So what can happen is people can finish the course and then go on and still get a job, but not necessarily have completed that endpoint assessment. But that's really important, and we need services to recognise that and bring that into that whole system, whole qualification process. And I think for now that's it from me. I'm more than happy to take questions at the panel. I confess I've not been looking at the chat box whilst I've been talking, so hopefully there's questions in there, but those are my details if anybody wishes to talk to me further outside of the meeting.
Thank you.
So back to you. Thanks, Claire.
Thanks, Kay. There's some comments in the chat bar saying it was a really useful and informative presentation, and I know what a complex terrain it is and how much work you've put into that, and that you've managed to simplify in half an hour. So thank you. If people want to put any more questions that they have in the chat box as they go through, we'll pick them up in the Q&A session. There's just one that you might be able to deal with really quickly, Kay, from Catherine Gallop, just asking how many people are in each cohort, how many trainees in each cohort, or maybe how many as a whole.
Yeah, our initial cohort was a cohort of 6, and then we had a cohort of what are my numbers now? I think it was around 30, Catherine, and then our spring cohort is going to be 53.
Right, and there's just one more that I'm going to pop in because I think it's a quick answer again. Claire Tilley says, is there an understanding that this will require a new apprenticeship standard to be developed, or are the new roles in relation to mental health to be accepted under the existing standard?
The existing standard is there, and what we've done is work with the universities to add into that. So there is no new standard that has been created. We've just adapted the existing one that is there.
Yeah.
Hopefully that answers the question.
Yeah. So take a look at the comments as well, Kay, because there's a number of positive comments. I think David Paynes is saying very clearest PowerPoint and explanation he's ever heard for the AP. So I think that's a good test. It looks like you might have actually, he might be trying to tout you for a bit of contact outside of this session.
Okay.
So let's come back to any more questions that arise in the Q&A session. So thank you.
No problem. Thanks, Claire.
Okay, so that leads really nicely onto Lindsay's presentation to look a little bit more at a little bit more in depth at the training programme and the apprenticeship standard that underpins it. I think the beauty of this role is that, as we keep saying, it's not a new role, it's an existing role with an apprenticeship standard that's already in place. What we're trying to do is just reintroduce it to the system so that its uptake can be looked at again with fresh eyes. So I will now ask Lindsay to share her screen, and if you're able to, Lindsay.
Thank you, Claire. I'm just clicking on the arrow there.
Lovely. I think there's a little bit of a time delay. Lovely. I'll hand over to you, Lindsay.
Lovely, thank you very much. So my name's Lindsay Robinson. I'm the Principal Lecturer and Academic Lead for Apprenticeships at the University of Central Lancashire. And the apprenticeships that I'm responsible for are the Health and Social Care apprenticeships across our university provision, which includes, I'm very, very pleased to say, the Assistant Practitioner. So I'm going to start by talking about what is a degree apprenticeship. And I'm sure that some of you are very familiar with degree apprenticeships, but just to put in context around the assistant practitioner programme. So a degree apprenticeship is a collaborative learning process between the university and employer, and I cannot stress that enough as part of the assistant practitioner programme. It's very, very much a collaborative approach between ourselves, the learner and the employer, and I'll be able to expand on that as we go along. Within an apprenticeship, an apprentice can be a new recruit or upskilling existing staff within the workforce, and that's very much an employer-led decision rather than a university decision. How a service or a manager wants to develop their workforce, we can support each of those. The critical thing about a degree apprenticeship is that it's a combination of what we call on-the-job and off-the-job learning, and the framework for apprenticeships, particularly assistant practitioners, absolutely allows for that to happen. The 20% off-the-job learning at the University of Central Lancashire is embedded with the 1 day a week attendance, and again I'll show you that as we look at the programme delivery. But what we require, as part of the apprenticeship is that the learner develops knowledge, skills and behaviours that are specific to that assistant practitioner role, but more importantly, specific to that workplace or service. And what we do is work collaboratively with the managers, employers to identify knowledge, skills and behaviours that are specific not only to that organisation, but to that service, to that team. And that's where the diversity or the beauty, if you will, of the assistant practitioner really comes into its own. As you're probably aware that there's many sort of professional degree apprenticeships, and what the learners develop on those programmes are quite often set in stone by regulatory bodies, whereas the assistant practitioner has the opportunity to be as diverse as practice or service needs are. As Kay mentioned earlier, that for every degree apprenticeship there is what we call an endpoint assessment. Now, some apprenticeship programmes have the endpoint assessment embedded into their course. That decision is made by the Institute for Apprenticeships, not through individual training providers, but the assistant practitioner programme has an endpoint assessment outside of the programme, which is needed to be completed, and absolutely demonstrates that collaborative approach between the training providers and the employers. As a result, the learners do get the academic degree award, but also they receive an apprenticeship award. Funding. So everybody likes to know about funding and how it all works. So the Apprenticeship Levy was introduced in April 2017 in line with the tax year. And for every organisation that has a wage bill of over 3 million, what happens is that a percentage of that is actually recouped as part of the Apprenticeship Levy. Organisations have no control over that. It's determined by the financial figures of each organisation. As clearly says there, no company is exempt that has that £3 million wage bill. So how the government have organised funding of apprenticeships is either that organisations can pay directly through the Apprenticeship Levy, and that is that money is organised and sent directly to the training providers or the universities or independent organisations, as long as they are registered as an apprenticeship training provider. And this all works through what they call the Digital Apprenticeship Service. All the funding is managed and monitored by the Education and Skills Funding Agency, and there's a link on the website there to all the rules around who can access what at what stage as part of the apprenticeship application. Now, in organisations, the apprenticeship levy funding is usually managed within training and education centres, or there's an apprenticeship lead within organisations that can support this. And also within the universities, we have teams of people that can support and direct organisations into accessing their apprenticeship levy monies. Unfortunately, if those monies are not spent within 24 months, what happens is that the organisations lose that money. So initially, when there was not many apprenticeship models available, organisations were losing their apprenticeship monies, but now there are more apprenticeships available. Organisations are carefully considering which apprenticeships they are able to fund through their own levy funding, and there's consideration again about which that leads into which roles are needed for which service. If organisations are a non-levy funding organisation, there are other ways, as Kay said, that all services can access this, and this is either through a co-investment model or a levy transfer. So as a co-investment model, training providers can support organisations to apply to the government for monies to support their apprenticeship, but employers are asked to pay the 5% apprenticeship cost for that. The other model for that is levy transfer, and that organisations that are paying into the levy fund may offer levy transfer to organisations for not. A model of this is NHS organisations may support GP practices, etc., within their locality or footprint. So there are different ways that levy funding can be accessed. So just moving on to the assistant practitioner journey at UCLan, we've been lucky to provide the programme since 2005 and supported over 750 assistant practitioners now across the Northwest in a range of services, from GP practices to theatre environments, from mental health into long-term conditions. There's a whole diverse workforce out there that we're pleased to say we've supported. But in 2014, the commission programme was actually mapped to what was then the apprenticeship framework. Again, lent itself absolutely fantastic to the nature of work-based learning. And from that, we were able to move to what is the current apprenticeship delivery. And I did include the apprenticeship standard in the chat earlier on. So we've currently over 150 students, including mental health students within the apprenticeship programme. And we work collaboratively, as I said, with mentors, managers, service leads to make sure that all our assistant practitioners meet the service needs. We've had 3 cohorts of learners that have gone through the whole apprenticeship process, and I'm really pleased to say that UCLan has got 100% pass rate in achievements within the EPA. So the focus and the project that we're working on with Kay and her team around further influencing the mental health assistant practitioner across the workforce in the Northwest has been led as majority of our assistant practitioner roles with a range of service drivers and importantly increasing access to psychological therapies. And what we've done is developed a programme that's specific to that service need, but using the current curriculum and the model of practice that we've been successful in for many years. So importantly, and as Kay shared, it is a collaborative approach. We did attend stakeholder events and we did seek working groups, contributions to development of the curriculum for the mental health AP. So we absolutely met the collaborative needs of each individual service, and what we did is we mapped those to the existing apprenticeship standard. So we didn't need to or consider any other apprenticeship standard that was out there. We felt that the healthcare assistant practitioner met the knowledge, skills and behaviours that were needed, but we could add more specific competencies in addition to those that are within the standard. We engage with a wide range of services, and we ensure that we develop the curriculum to individual service need. The programme is very much employer-led, and we support workforce development strategies consistently as the programme progresses, because the beauty of the assistant practitioner role is that it's dynamic, and we can enhance competencies as required for each individual service. So this is what our programme looks like, and again, just reinforcing what Kay was saying about the opportunity to undertake specialist modules within the programme. So there are core modules that we undertake for all our assistant practitioners, and then what they do is this almost specialise with options that are available to them. This is what the mental health assistant practitioner pathway can look like. We also have the coloured modules allow learners, because quite often the assistant practitioners are within the staffing numbers, but these modules, or the time in the year, allows them to, instead of coming to university that day, they may go to shadow a different service or observe a different practitioner in order to get a broad knowledge of that role requirements. So the curriculum is attendance 1 day a week, which meets the 20% off the job learning as required within a degree apprenticeship. But the flexibilities around the choices of modules that we develop for learners and the opportunity for work-based learning allows the underpinning knowledge, skills and behaviours specific to that service. We also offer a range of support within our apprenticeship programme delivery. So this is what on the left hand side, we've got what a traditional academic curriculum looks like, but within an apprenticeship, the column on the left demonstrates how we continuously work with our employer. We support mentors and managers with progression of learners throughout the course. We monitor and record work-based learning activities, which all we support organisations with things like role redesign. We share good practice, we share job descriptions, all within an environment that supports the development of the assistant practitioner role. We also look at policy development within organisation. I know that there's been a question about roles and responsibilities and crossing boundaries. So it's within forums like that, where we look at the policies, we look at standard operating procedures that may need to be developed for that role. We look at what the professional or the registered professionals are overwhelmed with perhaps, and are happy to delegate as long as it's within the organisational policy, can enhance the role to improve services. At the university as well, we've got lots and lots of additional support that can support degree apprenticeship provision. So the other thing that we're really proud of at the university is that we have a tripartite model, tripartite partnership to support work-based learning activities. So for example, the assistant practitioners are only with us 1 day a week, and the learning is over to yourselves 4 days a week. So what we want to do is ensure that there's a support for that activity taking place, and we have apprenticeship work-based educators that are the link between the academic team, the learner and yourselves as managers or mentors to support that learner for the duration of the foundation degree. What we want to do is ensure that we can monitor progression consistently, and that the learner is developing, and that the skills and knowledge are progressing, not only for the learners but also for yourselves as service, that you can see that there's achievements being made. So I've just identified there some of the programme and outcomes, or impact outcomes, sorry, and I think that these reflect some of the things that have been said in this morning's presentation, but from either a mental health perspective or an acute care perspective, we've found that these are significant outcomes that we know that an assistant practitioner role or opportunity to undertake that role can achieve. And then we've got just some examples there of how consideration of the role, looking at role redesign, challenging boundaries of what were traditional registered practitioner roles, and how that, if a more blended approach can happen. This is also examples of what the AP can achieve in practice. Thank you. And that's my details there if you need any further information. There's a bit of a whistle-stop tour, but I was conscious of time, Claire. Thank you.
Thank you, Lindsay. Thank you. You've summarised an awful lot of information very succinctly. Again, feedback that was really a really useful, excellent presentation. So thanks, Lindsay. What we'll do, if there are further questions that arise, pop them in the text box as we're going along. I think there's a lot of information that's being given to you over from Kay and Lindsay, so it might well be that it takes a little bit of time to synthesize it. So let's pick up any questions in the Q&A session. Right, so I think that between Kay and Lindsay, hopefully what you've started to get is a very clear idea of this role as having actually quite a clear structure and a clear framework for its competencies, with an education programme that sits around that is driven by the competencies, underpinned by the competencies, but also importantly gives flexibility to tailor that learning to the needs of the service, and also can be a role that can be very useful for initiating transformation of care pathways and helping develop new ways of working in that very clearly trained support role. What I would like to do now is hand over to Laura Smith from the BPS. We're really pleased to have Laura with us. The BPS being the overarching organisation for the psychological professions. They accredit training and professions. And what we've invited Laura to do is come to us to share. We've been having conversations with Laura about the BPS's interest in the development of support roles for the psychological professions. So we've invited her to come and tell us what they're doing in the BPS and what the direction of travel is in terms of thinking about support roles, and maybe hear some of Laura's reflections on what she's heard through the day as well, and how that fits in with the work that she's doing. So over to you, Laura.
Absolutely, thank you, Claire. Hi everyone. It's really good to be here today and hear about the innovative work that's going on down in the southwest, and also the development of the AP role in the north for the mental health work that's going on. So my name's Laura Smith. I'm the Workforce Development Manager at the BPS. I'm responsible for overseeing the development and activities related to the psychological professions, in line with workforce development, education and training needs. What I'm going to do today is just sort of talk you through, as Claire said, some of the developments that are happening in the BPS to support the psychological professions, and some of the wider psychological workforce developments. So what are the BPS currently doing to support the wider psychological professions? Well, there's a real wide range of activity that's going on, and the BPS supports and enhances the development and application of psychology for the greater public good. The Society's broader mission as a representative body for psychologists in the UK is really thinking about the evidence base of psychological interventions in a range of settings, so including health and social care, schools, prisons, and other areas of society. We recognise that workforce development is increasingly leading to the creation of non-regulated roles where work is a form of applied psychological practice. And we recognise the importance of ensuring quality whilst broadening access and meeting the needs of a changing society. And we really want to support the psychological professions pipeline to ensure that there are robust and coherent training routes, and that there's fair and reliable assessment, and also looking at the development of a transparent and valuable register for these roles for the public, trainees, training providers and apprentices. So all of this activity sort of outlined on this slide supports the delivery and promotion of education, training and careers in the psychological professions, and growing the supply pipeline to deliver the ambitious growth in mental health roles, and obviously to support the need of the NHS long-term plan and beyond. So I'm going to go into a bit more detail about, I guess, some of those areas outlined on the slide. So the first area is looking at accreditation of training programmes. So the BPS has well-established accreditation function. We have relationships with over 120 UK universities, and we operate a model known as accreditation through partnership. And this is the process by which the BPS works with education providers to ensure quality standards in education and training are met by programmes on an ongoing basis. Historically, we've focused our education and training on the protected titles and the routes through to these. But I think in the 10 plus years since the introduction of the IAP programme, the vision for what the psychological workforce and role should look like has changed. Back in 2009, we designed the accreditation process for the adult IAP to PWP training, and these standards were integrated into our overall accreditation portfolio. So we're very much well placed to offer quality assurance through the development and delivery of new accreditation standards for applied psychological training. So we currently accredit PWP, and we recently have developed accreditation standards for the associate psychologist training. So that will be used to accredit the new clinical associate in psychology programme that was developed down in Exeter, and also the clinical associate in applied psychology training up in Scotland. We've also got a set of draft accreditation standards under development for the children and young people's roles, so the child wellbeing practitioner and the education mental health practitioner roles. So we're working with NHS England and Health Education England to develop accreditation standards around these. All these, the PWP role and the CWP and EMHP role, they are, as you're probably aware, underpinned by a national curriculum. So the framework's sort of very well placed to be applied to a broad range of provision, some with national curriculum, some that are sort of newer in development. So the accreditation framework can be very flexible to recognise the broader psychological workforce and different applications of psychology. So relevant competencies, curricula can be integrated into the framework and structured around a core set of standards. So we feel that accreditation of training very much ensures robust and coherent training routes and fair and reliable assessment for those training to enter the workforce and those already in the workforce to train and develop their existing knowledge, skills and competencies. And this is really important, I guess, for the wider quality assurance piece. So training maintains appropriate standards for psychological professionals. We really see this as a blueprint for any NHS roles to accredit the training, and as I mentioned, sort of looking at registration within an appropriate professional body. And we've seen this in obviously different areas of healthcare, for example, medicine, that are regulated and registered in this way. So another area that the BPS is very keen to be involved with and support on is widening access and apprenticeship routes. And as we've already heard earlier today, we know that apprenticeships help to create skilled, diverse, flexible and motivated workforce. And they can really help to improve the diversity of the workforce by opening up employment opportunities for a more diverse entrants. And recruitment really needs to focus on this to make it happen. The BPS have worked with employers, NHS, Health Education England to drive forward these training routes and offering opportunities to ensure that the quality is maintained whilst broadening access. And we've been involved in the Trailblazer groups for the PWP and the CAP apprenticeship developments to safeguard the robustness of the profession through quality assurance activities. And for those roles, BPS accreditation actually underpins the apprenticeship standards. We have very recently become an approved endpoint assessment organisation known as BPS Assessment and Awards Limited. So we're looking to firstly offer endpoint assessment services for the PWP apprenticeship, but we are looking to also apply to offer endpoint assessment for other health and social care roles, including looking at the assistant practitioner role. And we would really like to continue to work with existing and new apprenticeship routes into mental health to support the quality assurance and assessment activities. We know that apprenticeship routes provide the opportunity to bridge the gap and create a route for the disadvantaged groups or those that perhaps left the education system early to gain education through an apprenticeship model. And by having the support roles such as the assistant practitioner as an apprenticeship route, this then supports pipeline roles into other, I guess, professional roles. So the PWP apprenticeship, where individuals will have prior experience in a mental health setting, and this then provides a structured route through to a more sustainable model for those in support roles to then achieve an elevated position into other roles, such as the PWP role. So another area that the BPS is working on is looking at individual practitioner registration. We are currently working with NHS England and Health Education England in developing a voluntary register for a number of roles. So working with NHS England on the PWP, child wellbeing practitioner, and the education mental health practitioner roles. And we're also looking at the wider psychological workforce roles as well. So as I mentioned previously, the CAPS, the English CAPS and the Scottish CAPS roles. And we see registration as an important part for these professionals to show their commitment to their area of practice and provide them with the recognition that they have the necessary knowledge, skills and competencies to practice. And it will better support them to be part of a professional community that works to high standards and policies and is underpinned by a code of professional conduct. On the other side, it offers employers and the public assurance that competency and safe practice and high standards are maintained. We're currently looking to apply to the Professional Standards Authority to have our registers quality assured by them. They assess organisations that register health and social care practitioners that aren't regulated by law, and this is a government-backed initiative to protect the public. So with registration, I think it's important because it offers appropriate oversight of the training routes, the entry requirements, and then the ongoing development for these roles. And it offers a further level of esteem and parity for people within these roles, particularly mentioned important given the anticipated growth in these roles to support the NHS long-term plan. We feel that recognition of support roles should be the start of this pipeline. So the development of new roles is a positive way to support the sustainable pipeline of talent within mental health services and to support broader mental health provision. A further area that the BPS are developing is their career offer. And this is from pre-university through to postgraduate careers advice. And we really recognise that there's currently quite a gap in careers information for psychological professional roles, and that it's quite difficult to navigate. And this has been brought to life through various research, more recently from the National Workforce Skills Development Unit. So it's something that we're really keen to sort of support and enhance. We have recently launched a new VLE platform called BPS Learn, which will offer CPD and other resources. We are, alongside that, we're recruiting a careers manager in early 2021 who will work with employers to really support workforce need and looking at how we can take this information and support the sustainability of these roles. We're working with employers and arm's length bodies to promote the NHS careers. And in terms of sort of schools and A-level students, we will be offering free membership to A-level students and personalised resources. And for teachers, we've developed a number of GCSE resources and have recently launched a teacher's toolkit that we will keep building on. We also want to support those that have not studied psychology and widen access to the psychological professions by providing information about other opportunities, support roles and career progression within the psychological roles. And I think this is a real opportunity for us to collaborate, to really kind of highlight these roles both inside the NHS and outside for those that may not be aware of them. So we want to make sure that we're providing high quality, accessible careers guidance resources for schools, the public, trainees and employers. So bringing it back to the assistant practitioner role, we really recognise that this role can be based within mental health settings as a multi-professional into different pathways, gives it a really wide application and a provider focus, and it offers a multi-professional care pathway. The training route is flexible and can be used to very much meet service needs. And as Kay has already mentioned, the assistant practitioner role helps to increase the skills mix within the organisation. It widens participation and it brings people into the caring profession at an early stage, building on their existing skills, ability and performance. And as was mentioned previously, growing and developing talent and supporting those who we know would make really good assistant practitioners and could really benefit the mental health workforce. It helps to diversify the workforce and kind of bring in talent from those with perhaps non-standard qualifications. It supports workforce growth, expanding on recruitment and extending career pathways. And really the ambition would be that this lower band support role would allow a more diverse profile of learners that would bring benefits, as we've mentioned before, of lived experience, different backgrounds and non-traditional routes into these roles. And it provides an opportunity for individuals to progress further through this route and build on and formalise aspects of their development and learning whilst working within a particular setting, and offering a further level of effective care. So bringing that all together then, all of this activity that the BPS is involved in and wanting to get involved with, all the great initiatives that are happening, the successful delivery and provision of education, training and careers in the widest sense, and includes a robust quality assurance and assessment framework to ultimately ensure public confidence in these roles and to really promote the discipline of psychology and the psychological professionals more broadly. Focusing on the support roles will really enable wider recognition for these roles. And the BPS wants to work to provide a valuable offer for these individuals and for those working in these roles, and new roles in the future, including things like peer-to-peer networking, interdisciplinary knowledge exchange, and they'll be part of a community where they can have access to and insight across a range of psychological professionals, and that diffusion of knowledge we know is really beneficial to develop learning and practice. And these new support roles offer the opportunity to truly deliver on the prevention agenda and deliver an innovative suite of training routes that will support and promote psychological interventions and develop a sustainable pipeline of psychological professionals. Thank you.
Thank you very much, Laura. A very informative and really useful overview of the work that the BPS is doing. And really interesting to see the BPS thinking about where trained support roles fit in widening the supply pipeline. And I can see we've got a number of questions that have come up in the chat box. What I'll do is I'll invite people to keep putting their questions in, because I think there's some really important things that have been prompted by your presentation. But can I suggest that we have a 5-minute comfort break? If we can come back I'm hoping maybe 10 minutes, give everybody time to get up, stretch their legs. So if we come back together at 14:50 at 10 to 3, keep putting in your questions, and we'll come back together and have a look at the implications of all of what we've heard. Okay, so see you at 10 to.